Ana Claudia Rosa is the real way to say your name. Seja bem-vindo ao Boundless Body Radio.
Obrigada. Thank you so much.
Thank you so very much. Thank you for being on the show. It was actually harder for me to try to read your name, not the Portuguese way of saying things, so it would be Ana Claudia Rosa. It was harder to read it in English, but I wanted hopefully people to know your name and know the way we say it around here.
Yes, it's a pleasant coincidence that Chase knows how to speak Portuguese, as he was in Brazil for some portion of his life. And I am Brazilian, so it was really nice to get to meet him and be able to speak Portuguese and English with him about visceral fat and about health optimization. I am really grateful to be here. Thank you so much for inviting me and searching for me. And my intention here in the podcast is, like I've told you before, to bring awareness for providers who are ordering the scans, to bring some kind of guidance for the patients who I want them to become not like really patients, but active clients, advocating for their health and searching and asking for prior scans and looking at their scans themselves and discussing with their providers. And also for the people who have more power in dealing with insurance, so then they also could advocate for their employees, right? So I'm here to bring awareness, talking about visceral fat, my own journey as a person and my own journey as a professional. And I'm here to explain a little bit how imaging could be of help, a lot of help. And also for everybody to know that it's really important to have a good medical provider that advocates for your health, for optimization of your health, like Dr. Sean O'Meara, my friend. And also that radiologists are very important and very knowledgeable in visceral fat and everything else that is going to be in your scan. So although you're going to learn to see visceral fat, the radiologist is still super important and not replaceable, because there are other things that are very important happening in your body that the radiologists are of help, and that's why we exist, right? To be here to take care of you all. Yeah.
Well, we really appreciate that, and that's such an important thing to mention, is that we're not trying to, take away radiology or radiologists. It's how to make their job more effective. Just like so many other things in the medical industry, it's just something that is not taught. People don't know about it. It's not the provider's fault that they don't know these things, but that's why we're here, is to get that awareness out. And I'm so glad that you have started doing that. I came across your work when you did the podcast with Brian Sanders. We've also had him on the show, on the Peak Human podcast. And I was about 20 minutes into hearing the conversation. I was already trying to look you up and try to get you on our show as well, because I could just hear the passion in your voice. And I would expect nothing less from a Brazilian to have lots of passion about something. If it's not football, then something else. But yeah, it is an important topic that we don't know that much about. And you're right, your personal story does tie in with this quite a bit. So let's start there. What got you interested in, the medical industry and radiology in particular back when you were living in Brazil?
So I am, like Chase said, I am Brazilian, and I did my medical school in Brazil, and I graduated in 1994, and I started doing the radiology residency, and I finished it in 1998. And since then, I have been a radiologist for my whole life, since I'm 52. And I love being a radiologist, especially now that I'm more specialized. I came to the United States in 2008 when I got married, and I lived in Minnesota. My husband passed away in 2016, and I moved to Nebraska 2 years ago, and I'm here in Omaha now. And I love being a radiologist. I got my medical degree here at the United States through the USMLE and ECFMG, like all medical foreign doctors. And then I did the radiology residency at the University of Minnesota, and I consider the University of Minnesota my family. And then I started working at the VA in Minnesota when my husband was very sick. When he passed away in 2016, I went back to the University of Minnesota to do the body fellowship training. And I am so very grateful for all the things I have learned in Brazil and here in the United States. it is very important to understand that radiologists see visceral fat every day. We do see visceral fat every day. And in fact, when a patient does not have much visceral fat, the study becomes a little bit more challenging to read because everything is more crowded in your abdomen. So we kind of like visceral fat, quote unquote, because visceral fat makes things easier to see because it's just displacing everything and the organs are just floating in the ocean of visceral fat, like Sean says. I have never learned to describe visceral fat in medical school or during my 2 radiology residencies and during my body fellowship. And again, it's not because radiologists cannot see visceral fat or are not trained in reporting visceral fat. It's just because it is something that we as radiologists just go through it as if it's normal. You know, almost everybody has visceral fat now. When you don't see visceral fat, this study is harder to read. And that's sad. It's sad because we sit in conferences day in, day out that talk about Alzheimer, which is now quoted as diabetes mellitus type 3, that talk about diabetes, prediabetes, and talk about fatty liver, and fatty liver evolving to inflammation in your liver, and then cirrhosis, and then liver cancer. And we sit in conferences discussing liver cancer and all these amazing treatments that exist for liver cancer, but we don't step back. And that's why I'm here, because I want to bring awareness together with Sean and Omara and all the other doctors that are talking about health optimization. My goal is to bring awareness for all my radiologist colleagues that how about we step back? We start describing visceral fat in all the scans we are reading, since it has been proven that visceral fat is the root, is the cause of the majority of these things, right? So visceral fat leads to insulin resistance. Visceral fat leads to prediabetes, diabetes, fatty replacement of the pancreas. Visceral fat leads to, it has been proven, like fat around your heart and cardiac abnormalities in conduction. Visceral fat can be is studied to be a cause of mental disorders and dementia. Visceral fat, I'm citing everything in your body from head to toe. Visceral fat can give you like fatty liver again, inflammation in your liver, cirrhosis, liver cancer. Visceral fat has been linked to autoimmune diseases. Visceral fat has been linked to inflammation in your body that leads to cancer. So, and the patients who have visceral fat, if they are obese, they also are in the class of people that are more prone to have colonic diverticulosis or gallstones, and the fat in your pelvis makes your organs to be more relaxed. So then you're going to have something that it's called pelvic organ prolapse that is responsible for incontinence in women and prolapse of your pelvic organs, you know. And what else? Visceral fat also. Oh, when you have visceral fat and you have metabolic syndrome, then you start replacing your muscles with fat, which Sean calls so well the marbling of the muscles and the sarcopenia. And that's another thing that I want to bring awareness, is that it's very important to follow these strategies to optimize your health, because it is really not about getting old and being less fat or skinny or cute or whatever we used to think when we were 30 years old, or I used to think when I was 30 years old. Now I'm 52. My goal is I want to be 70 or 80 or even more, but I want to be functional. I want to have a functional body. You know, there is ice here sometimes and I fall. What do I want from my body? I want my body to fall in a way that I'm going to get less hurt, or I want myself to be able to fall and stand up alone, and stand up when I go to the restroom. Like I saw my husband so many times not being able to stand up because he had sarcopenia due to the cancer, right? So that's the sarcopenia, that visceral fat and being sedentary and allowing your muscles to be replaced for fat it happens. It does. You don't have to have cancer to have that, right? And the MRI is such an important tool because it allows us to see the visceral fat. It allows us to see all the other stuff that I mentioned regarding the liver, the bowel, the pancreas. And that's why the radiologist is so important, and allows us to see also the muscle replacement by fat.